Welcome to Dr. Linda Page's Health Secrets CD. Part 7. Dr. Linda Page discusses whether herbal antibiotics can do the job healing colds and flus.
Americans catch more than 66 million colds a year and cost the U.S. economy an astounding $40 billion. During high-risk seasons, over one-third of the entire U.S. population has had a cold or flu within the last 2 weeks. Children in daycare are definitely the hardest hit, experiencing up to a dozen colds every year. A cold is actually a natural detox mechanism. Your body opens up and drains its elimination channels, coughing, sneezing, or diarrhea, to relieve itself of waste and bacteria that have built up to a point where your immune response can't overcome them. Drugs and over-the-counter medicines only relieve the symptoms of infection. They don't cure it and can make the situation worse by drying up mucus elimination, thus keeping the virus or harmful bacteria inside your body. Antibiotics are not effective against virally caused infections either. Colds and flu are separate infections triggered by over 200 different viruses. Flu is more serious because it can spread to the lungs and cause bronchitis or pneumonia, but many of today's viruses are so aggressive even a cold can be quite debilitating. I'm asked frequently about how to tell the difference between a cold and flu. Here are a few patterns that help differentiate colds and flus. A cold profile looks like this. Expect a slow onset with body aches due to the release of interferon, an immune stimulator. Expect a sore throat with sinus congestion, listlessness, runny nose, and sneezing. Mild fatigue and weakness will occur temporarily as a result of body cleansing. You may have mild to moderate chest discomfort, usually with a hacking cough, and a sore or burning throat is quite common. A flu profile looks like this. Expect swift, severe onset generally with flushed, hot, moist skin. A flu is usually accompanied by high fever, 102 to 104, a headache, and sore eyes. Expect chills, depression, and body aches, and extreme fatigue, sometimes lasting for 2 to 3 weeks. You may have acute chest discomfort, too, with a severe hacking cough. A sore throat occurs occasionally.
Dr. Page, what can you do if you're hit with a cold or flu?
Of course, first, get plenty of rest. Second, homemade chicken soup really can help you get over it faster, especially if you add healing herbs to the soup, like garlic, ginger, and shiitake mushrooms. And I've found herbal antibiotics are a great choice because they stimulate your body's natural detox mechanisms. Here are my most powerful infection-fighting formulas and how I use them for the best results. For Crystal Star antibiocaps, I blend 2 different echinacea species to provide immune defense support on all body levels. I find a blend of echinacea species work far superior to one echinacea by itself. I also add anti-inflammatory herbs to the formula, like coptis and golden seal, to ease other symptoms like aches and pains. Antibio formula can help people with a broad range of health concerns: colds, flu, bladder problems, dental problems, and sinusitis. And here's another tip. I use it with my Zinc Sore Throat Rescue Spray to fight colds that begin with a scratchy sore throat. For Crystal Star Virex, I developed a formula to help fight more aggressive viral attacks. Olive leaf in the formula has been found to inhibit the growth of many types of viruses, bacteria, funguses, even parasites. As a body purifier, olive leaf cleanses the colon of infective waste that may be keeping you sick. Whole herbs in Virex also increase lymphatic drainage, so symptoms like swollen glands and excess mucus are relieved. They're not a cure, but Virex caps do help you feel better if you're dealing with a virus.
What about bronchitis and pneumonia? Are natural therapies a good option?
Sometimes a cold or flu can lead to serious secondary infection, like bronchitis or pneumonia, particularly if the person is a smoker or has very low immune response. Don't risk your health if you have a major difficulty breathing. Immediate medical treatment may be necessary. Newer, broad-spectrum drugs can sometimes give your body a breather from the trauma, and they are less harmful to normal body functions than most primary antibiotics. Still, there are many natural ways to restore your own immune strength and feel better if you're affected. Here are some good diet watchwords. 1. Follow a largely vegetarian diet for 3 weeks, low in meat and dairy foods to allow lungs to heal more easily. Avoid sugars, starchy and fatty foods during healing to reduce congestion, because these foods allow a place for your virus to live. 2. Try cleansing broths, hot tonics, high vitamin C juices, vegetable juices, green drinks. 3. Consider herbs to help restore immune strength. Here's my personal defense. I use Crystal Star Antibio Extract with antiviral support to help overcome these types of infections. Crystal Star Decongest Spray is another good choice, which frees up your breathing passages by loosening congestion. Slippery Elm in the formula soothes that dry, scratchy throat and relieves coughing attacks, too. I also recommend Dr. Enzyme formula with protease and bromelain, which contains enzymes and whole herbs that enhance immunity by cleansing the bloodstream. Use this formula between meals for best results.
If you have a serious health problem, Linda Page and Crystal Star Herbs recommend you seek advice from a health professional. The information in the following educational segments has not been evaluated by the Food and Drug Administration. Crystal Star products are not intended to diagnose, treat, cure, or prevent any disease.